Welcome back to another episode number 5 of Unpain Clinic podcast and YouTube channel, wherever you're connecting with us. Hi. So today we are going to talk about knee joint and trying to understand why you have knee pain or what's going on with a knee pain that it's not going away, and just trying to understand more the mechanism of this joint, how it works, how it functions, why it hurts, um, what can you do even if you're at that stage where you need a knee replacement, and what to do after it, and some other things. So I personally, and please don't get me wrong on this, I call knees dumb because there's usually never a cause of the knee pain. So unless you fell, you got in car accident, you hit it somewhere, then yes, it makes sense. You have physically injured your knee and therefore it's hurting. But any other times, any other cases where you ended up with chronic knee pain and you have no clue where it started and how it started, it's usually the cause, it's either the hip or the ankle, because those two joints are more complex. One touches the ground, the other one controls your whole leg, and the knee joint is just in between, almost like being as a spring, just kind of minimizing the impact that can actually come from the hip towards the ankle, or vice versa, from the ankle towards the hip. And as a joint is very simple. You have those two bones kind of close together, and it only does like flexion extension. So you can straighten your knee or you can bend your knee. There's no much rotation that happens on the knee joint like it is on the hip and the ankle. So what I've learned from my experience and what I typically see in my practice is that if somebody had, let's say, sciatica problem in the past, or lower back pain, lower back problem, and they treat it once, but they kind of just reduce the symptoms. So they pretty much just help their body to adapt to that dysfunction. So that's what happens when you only treat the symptoms and you don't treat the cause. So now your body is actually allowing more weight to go on the knee from the hip, like from the upper body. And then the joint from the top start pushing more into the bone that is underneath the joint. And the same happens now if you sprained your ankle, you did not treat it properly. Now your body, it's actually applying forces now from the bottom up, and again causing knee dysfunction. And when, imagine this, if you take a glass of water and you hold it just for like 10-15 seconds while you drink it, it's very light and easy. But try to hold that glass of water in one spot just on your hand all day or all week or months and years. You can't. So the same thing happens with a knee joint. It can only compensate. It can only handle so much. And then there's a point that it's going to start actually wearing out. It's going to start kind of eating or destroying its own mechanism, and then it starts hurting and giving you trouble, giving you difficulty or pain when you go upstairs or downstairs. And then you go and get an x-ray, and then you see some physical changes, and then they say, oh yeah, we found out where your pain comes. It's this spot, look at it's wearing out and it's arthritis. And oh yeah, you're gonna need the joint replacement eventually, like that's what's gonna happen. But let's just try a cortisone shot. We'll inject it in the area, and then the pain it's gonna go away. And then if you're lucky that the cortisone shot works for you, yes, the pain is going to stop. But you have to remember that that dysfunction, what caused that problem in the first place, it hasn't been treated. So even though you don't feel the pain because you had like anti-inflammatory cream put on your knee, or you had a cortisone shot for on the knee joint, the dysfunction, it's not corrected, and eventually it's going to catch you. It's going to hit you. But when it comes back, it's going to be even worse than on the first place, because usually with cortisone shots or steroids, what happens is they make the soft tissues more fragile. And any joint in the body, it's actually supported by soft tissues. So soft tissues stabilize your joints and they make them move. So if you have a problem in the joint, most likely you have a problem in the muscles, in the soft tissues. The only time when the joint really messes up muscles, affects the muscles, if you were in a car accident, you hit the dashboard with your knee, you landed in your knee, you were playing sports, it was like high impact injury. Yes, that's the time where the joint becomes kind of the cause more towards the causing the dysfunction on the muscles. So yeah, when it comes back later on, after, trying to just, it's almost like there's an alarm going off and you're trying to close your ear instead of going and trying to figure out why there is alarm in this building, in this area. So usually after the cortisone shot doesn't work anymore on the knee pain, excuse me, then you're going to start looking for, other alternative therapies, probably, physiotherapy, chiropractic, massage, acupuncture. And I'm glad if you're somebody that you're starting there, that's great, because at least with those modalities, you're trying to look more into the dysfunction of the joint. And then if you're somebody that already have been through all of this and you're still in pain, that's where we come in. That's where unpain approach and modalities and technology and techniques come in. So we help people that have been in pain for minimum 3 months and have tried everything else unsuccessfully. So typically what we would do in those cases, if somebody comes with a chronic knee pain, that it's having difficulty going upstairs, downstairs, every time when they go from sitting to standing, feel pain and it grinds and it makes noise, then we would actually treat you with shockwave therapy. That's our tool currently. In 2021, we constantly add different tools in our toolbox, but the ones that actually work together, what we already do, and just to stimulate the body to heal even faster, because constantly we are trying to actually reduce the time of rehab, of healing. Currently, we only treat people in pretty much any condition 3 to 5 times, and then we let the body heal and see where it goes. And most of the clients, they don't need to come back. That's all they get from us. So I'm just gonna take actually an example of client that had knee problem, both sides, bilaterally. So every time when you have a pain, both sides, usually the cause is not with the joint. It's coming usually from the core, from the lower back, and it's affecting you down. When the pain is only one side of the knee, most likely it's coming from the ankle. So you sprained your ankle and then it's affecting more of that joint. And that's how we kind of differentiate, or that's how we look at you. So a client had an appendectomy on the right side when he was very young. So every time when you have a surgery in the body, scars can cause muscle dysfunction. They can mess up the way how your muscles actually fire and they work. So when you have appendectomy, C-section, tummy tuck, gallbladder surgery, breast augmentation, open heart surgery, you name it, in the abdominal area, your core muscles become dysfunctional, your back takes over. And that's why If you're somebody that have lower back pain as well as knee pain, and you had any of those surgeries, most likely the cause is coming from those scars, because scars affect the communication between your nervous system and the muscles, but also they physically pull you towards where the cut is. So anyway, now muscles become dysfunctional, the core muscles become dysfunctional, your back takes over because your nervous system doesn't let you to challenge like it doesn't let you fall. It has to keep you upright against gravity. So then the back muscles take over, and then glute muscles take over, like you get super tight there, you're not walking properly, you're overloading your knees, and that's how the pressure comes down to your knees and start wearing your joints. So what we typically do is we go and treat the scar first on the first session to reactivate your core muscles, and it doesn't matter how long your surgery has been. We have a question that we ask every single client at Unpain Clinic. We say, any surgery from the time you're born to today? And people ask us like, oh, but it was 60 years ago. Yes, but you still live in the same body. You didn't change the body, right? So it's affecting you, and injuries don't have expiry date. So once you get injured, it's either going to heal or you're going to adapt. So that's why healing properly, it's very important. So we treat the scar, we go and check if there's leg length discrepancy, is your pelvic pulling, double check your ankles, how's the range of motion on the ankle. But in the case where there is a bilateral knee pain, like both sides, both knees are hurting, we focus more on the lower back. So we have to go and treat the whole lower back on the first session. And then we go down to the knee and look at, okay, are the tendons thicker? Is there swelling around the knee? Is there heat around the knee? How much you're actually straightening your leg, your knee. So if you have a knee pain, just try to do that. And if your knee doesn't fully extend, imagine if you're just sitting and doing nothing and you're straightening your knee and it doesn't extend fully. When you're walking, it's not going to extend. It's not going to do anything different because that's your range of motion. And if that's happening, imagine what you're doing to that joint inside. It's you're grinding it more, you're hurting it more. So when there's actually limitation in knee extension, the straightening of the knee, usually there is a muscle behind your knee. It's called a very small muscle called popliteus muscle. It's small but mighty, very, very powerful, like your jaw muscles, your masseter muscles. So once there's a knee problem, and once that muscle goes in compensation, it becomes 200 to 300% tighter. So that's the muscle that limits your knee extension. See, we have to think holistically. We have to kind of break apart all the scenarios, like how you ended up with chronic pain. And so we have to go and treat behind your knee because that's where you have more blood vessels. That's where there's a bakery cyst. That's usually pretty much a reservoir of the lymphatic system. When you have too much inflammation around the knee, it's going to go somewhere. It has to go somewhere. It's like if it cannot go anywhere, then it's going to start swelling up, and that's why it pushes your skin. It stretches everything, and you can actually physically see the swelling. But before it gets to that point, there are some other reservoirs inside the body that we cannot see, and they are the ones that fill first. Okay, so we have to go and treat back of your knee. We have to relax your hamstrings, your calf muscles, what we call it the popliteal area. And then we go in the front of the knee and check, okay, are quadriceps muscles working properly? Are you somebody that you have been sitting a lot, you're driving a lot, you work at office for living, and those quadriceps muscles, those very powerful muscles, like 4 muscles, have become so weaker that they're not stabilizing your knee from the front. And what happens when the muscle becomes dysfunctional is now the tendon takes over. So your patella, your kneecap start kind of almost like the structures around start getting thicker. And then the patellar tendon, there is almost like a small tendon that goes from your patella to the tibia bone, which is like the lower leg bone. That's where it attaches and it gets thicker. So now if we have all those structures not tracking properly, not working properly, obviously you're going to have knee problem. So wherever you are in the world, think this way. Even if your practitioner doesn't think this way, find somebody that looks at you in like from this perspective, from this view. So then they can go and make sure that the cause is treated. Let's say you are lucky, you found this practitioner, those people to treat you this way, but you already had 20 years of knee problem compensation, you wear out that joint, it's still okay. Even if you're to a point now that you end up with joint replacement, it's totally fine, because you have to understand, even with a joint replacement, even with a knee replacement, the mechanism that moves your joint doesn't change, doesn't get replaced. And this mechanism, it's your muscles. So the muscles, the soft tissues around, they're still going to be the same. So there is a saying, it's like with whatever you go into the surgery, that's what your starting point after the surgery. So before you get knee replacement surgery, start strengthening your glute muscles, your core muscles, your quadriceps muscles, start stretching your hamstrings, your calf, even if it doesn't alleviate the pain. So whatever you can do, try to get those tissues going. So that way, after the surgery, whatever you gained prior, it's going to help you to recover faster, because now the joint doesn't have any problem anymore. It's bionic joint. But muscles now have been injured from the surgery, from the cut. There's fascia pulling, there's another scar, there's a lot of dysfunction. So therefore, you have to get going as soon as possible right after surgeries. And physios are actually really good for that, for that type of rehab. So try to find a physiotherapy clinic near you that can like specialize in knee rehabilitation, like post joint replacement, so they can get you going with exercise. And about 6 weeks after that, you can actually find a clinic near you that would do shockwave therapy for the knee, or after joint replacement, because then shockwave, it will get the healing going. So if you're somebody that just ended up here and you have no clue what I'm talking when I say shockwave therapy, I'll just explain it a little bit. So shockwave therapy, it uses sound waves. It's the same technology as they break up kidney stones with. So it's been used in rehab since the 90s. It started initially in Germany. And in Edmonton, Alberta, we have been doing shockwave for over 11 years. One thing that you have to always be careful is that in the market, there are a lot of clinics, a lot of places that promote, they say we do shockwave therapy, but the tip that I want to give you every time, if you want to choose the place that has the right shockwave, is if their unit, if their machine sounds like a jackhammer, it's not a shockwave, it's a radial pressure wave. If they don't have the true shockwave, it's totally fine. Go ahead and get that, because there is a saying, if there's no rain, hail, it's still good. Okay, so you can still get benefits from it, but you need the true shockwave, because the true shockwave, what it would do, it will break down scar tissues and adhesions up to 12 centimeters deep in the body. And that's very, very important after joint replacements, because your scars now are much deeper than they previously were, probably prior to the surgery. And then it stimulates new blood vessel growth. So wherever shockwave, true shockwave is actually applied, there is 200 to 300% more blood circulation in that area. And about 8 to 9 weeks later, that's the highest stem cell activity in that region. So shockwave triggers your stem cells. So you can almost like call it a stem cell activation therapy. And then your body now is triggered to repair everything that has been injured in the area. So this is the same mechanism, whether you had the joint like knee replacement or you just have chronic knee pain. It's shockwave is just a stimulation, and it does this with virtually no side effects. And even after joint replacement, the metals are not contraindication for shockwave. So knee replacement are not contraindication for shockwave, because shockwave uses purely sound waves. It's a very short wave. It's about 0.2 to 0.60 nanosecond. There's no heat or cold released. And if it hits the metal, it's just going to reflect. It doesn't have the power to physically break down the metal, especially the shockwave that is used in orthopedic field or like for rehab. Lithotroppers, the ones that are for kidney stone, I don't have experience with them. I have no clue, but they are usually very powerful energy. So that's completely a different story. So shockwave, we typically aim for 3 sessions when we treat 3 to 5 sessions. It depends on the knee pain, but minimum is 3 sessions, maximum 5 sessions, and then a session can be done once a week. After you finish the initial protocol, what is called the treatment phase, we suggest you to let the body heal for minimum about 4 to 6 weeks. And then if you're happy where things get, that's it. You don't have to come back. If things get much better, but still bothering you, then we are here. We can still help you more. But if we treat the same area, then we only have to do like 1 session and then give it a couple of weeks. So just kind of keep boosting the body to heal itself more and more. So these are and the good thing with shockwave therapies for chronic knee pain is that you can combine this with any other modalities. If you're actually working out, if you're getting physio, if you're getting chiropractic, if you're getting massage or acupuncture, it does not interfere with those other modalities. So I don't want to go more into the knee joint because there's not much more, honestly. It's the only other time that we can talk more about the knee joint if we start naming the conditions and the dysfunction. So where you call it like patellar tendonitis or tendopathy or chondromalagia, which is like where your patella, your kneecap, it's actually rubbing against the bones on the knee. But the mechanism of the knee dysfunction is pretty much the same. Because everything starts kind of with muscle dysfunction first, wearing out, giving you some signs, giving you some pain, just telling you that, hey, whatever you're doing, you're not walking properly and you're not doing proper things. And then if you don't treat it, if you keep ignoring that, then it's going to get to a point that your body says, hey, I need to adopt because this person is not, this brain, this human is not listening to me to take action now. And I'm going to catch him later on after 10, 15, 20 years, 30 years. And then that's how every chronic pain or every dysfunction in the body happens. But if you wait for somebody to take care of you, that never happens. So you have to get in charge. You're responsible for yourself and focus on your health, because that's the biggest wealth. That's the most important thing that you have. There's no other house for your spirit, for yourself, than your body. So take care of it. If you're doing oil change on your car every 10,000 kilometers, are you getting are you having a massage for yourself once a month? Are you making sure what food you're putting in? Are you making sure after you eat, like, how do you feel? Are you getting energized or are you getting tired and sleepy? If you're getting tired and sleepy, then it's not the right food for you. So there are multiple factors when it comes to healing and even getting injured or ending up with a chronic pain. So we make it simple because it took us years of education and like learning different technologies and different approaches. That's why my goal always has been and is, and I'm still looking to see how can we make the healing to be like faster, effective, that works, and how can we regenerate humans as non-invasively as possible. So yeah, when it comes to regeneration, there are like a couple other modalities that you could benefit a lot from it, or the stem cell injections, PRP injections, and these are more to physically repair the injured structure, but they still don't treat the dysfunction. So whatever you learned so far, the only way to correct those are through, proper physio approach, like proper um, like muscle treatments, soft tissue treatments, um, self awareness, like just trying to listen to your body, how you're walking, how you're moving, changing the habits in your life. So but I had so many clients that had stem cells and PRP injections for their chronic knee pain, and it helped them a lot. But then I had cases, I remember a guy who flew to United States when stem cells kind of like they just started in United States for knee joint. He had the treatment. He paid, I remember, 5,000 US dollars for the injections, and it did not do anything. He came back with this shockwave, and we corrected the problem. But that was an example where the pain or the dysfunction, it wasn't the degeneration in the joint. It wasn't the x-ray what they saw. It was more the mechanism that moved that joint. But yeah, shockwave, what we suggest, because now PRP is more available, what we suggest to clients, we say, let's do shockwave first. Let's kind of get the healing going, and then you can boost it with whatever you want, whether you decide to get injections and boost the healing more, or focus on the nutrition and the movement. That's up to you. But everything, it's like a lot of things are available nowadays, so please look before you make a decision to do a surgery on your knee, because every time when there's a surgery on the knee, it's like there's no return. It's we can still do a lot in the body, not just us, but a lot of great practitioners out there that can still help you if the body it's still intact. But as soon as there's a cut, there's physical change, then it's not as easy. Okay, so thank you for your time. I hope that this conversation, this kind of download of my knowledge to you and sharing my experience with you is going to help you to even get a little bit more clarity about the chronic knee pain that you are experiencing, or not you, but somebody that you know. And hopefully this will help somebody to take a decision and make a decision and start changing their habit, because without changing the habits on the life, nothing is going to change. So if left doesn't work, turn right. Okay. So thank you for your time, and have a great time till the next episode. Okay. Bye-bye.